Hello and welcome to a Lexington Senior Living training video. This one will be regarding dementia, patient and staff safety. This presentation is aimed at helping you familiarize yourself with dementia and how to handle situations safely regarding residents who have dementia. First off, I would just like to say welcome to the team. This video is a great resource that you can look back on even after you have started working and should help you as you work with patients who suffer from dementia. Your onboarding plan will include what is dementia, the 3 stages of dementia, confusion and wandering, which are symptoms of dementia, and finally, emergency planning. So what is dementia? Dementia is not its own diagnosis. It is a symptom of other conditions, but it is a neurodegenerative, progressive illness, and it is always terminal. Because there is no cure for dementia, it cannot be fixed, stopped, or reversed, as dementia is literally the constant changing of the brain. Dementia can come from over 85 different conditions, some of those including Alzheimer's, Parkinson's, alcohol-related, MS-related, Lewy body, frontal lobe, vascular, genetic, and etc. Dementia is more prominent in those 65 plus. Some of the effects of dementia are because it affects the human brain and decision-making. There are a lot of signs that someone is suffering from dementia: forgetfulness, confusion, inability to speak or understand language, hallucinating or making things up, and wandering. Trouble recognizing common things or people are very, very common signs that someone is suffering from dementia. And it is more than just the average forgetfulness or confusion, but a little bit more often and frequent. Other psychological changes include personality changes, depression, anxiety, paranoia, or inappropriate behavior. Dementia affects everybody differently, and it affects different parts of everyone's brains differently. So not everyone that is suffering dementia will show the same symptoms. There are 3 main stages of dementia. First is the mild or early stage, which is when a resident will have largely be able to function independently, and they suffer from the occasional forgetfulness, confusion, or lapse in judgment. It is kind of hard to differentiate the mild or early stage from just getting older and having memory loss in general, from just aging. But then the second stage, which is a moderate or mild stage, they begin to ask for assistance completing everyday activities, such as brushing their hair, brushing their teeth, just things that they don't think that they remember doing. And they associate that with memory loss and confusion to a greater extent than what is being shown in the early or mild stage. The third and last stage is severe or late stage. This requires 24-hour care and supervision, and it begins to have a loss of mobility because they forget how to do things, and they have trouble speaking and swallowing. Severe or late stage is also more prone to sundowning, which is when the sun goes down, they forget like what time of the day it is, if it is morning or night. And that is something to really watch for, as you will be a resident assistant in our senior living facility. One of the most common symptoms of dementia is confusion. It is present in all 3 stages of dementia. Confusion can become worse if a person's living environment has changed or their daily routine switched. So it is very important as an RA to not mess with their room or organize it, even if you feel as though it is messy, because to them, everything is where it's supposed to be. Also, assisting to make sure that their daily routine is not switched around and that we stick to our schedule that we have planned for each resident. The best way to respond to confused residents is to stay calm and collected. Make sure that you do not antagonize or try to correct the resident. Also, being brief when responding to avoid further confusion. Do not use large words or complex sentences. Keep it simple. Also, using reminders or suggestions to help them figure it out or focus. Maybe using keywords that you know as you start to work with them and learn more about their individual personalities, about maybe their children, their grandchildren, their husbands or wives, to help them bring back to reality. Also, to make sure that the confusion is resolved before leaving them. If you find a resident confused, please do not walk away from them and hope they figure it out themselves. We are here to help them. That is our job. Another extremely common symptom of dementia is wandering. About 3 in 5 people suffering from dementia will wander at least once due to lack of realizing or remembering their surroundings. This also is part of the confusion. When things aren't where they put them or they are placed in a new environment, it is hard for them to remember where everything is and where they are, and sometimes who they are. Some ways to reduce wandering are to have a well-structured daily routine, identify the time of day wandering is occurring and watch out for it. In most cases, this will be the sundowning when it gets dark early, especially with time changes. Please watch out for this in our residents. Also, reassuring the person when they are lost and walking with them to wherever they are going, making sure that they don't feel like they are lost and that they have just, wandered the wrong way and that we're just going to take them to where they need to go. Also, avoiding a lot of busy areas with lots of foot traffic is very important so that they don't feel flustered. Emergency planning is important, especially at a senior living facility. It's important to have it pre-planned so that in the case of an actual emergency, there are clear procedures to be followed. Depending on the emergency situation, there are different protocols to be followed, such as calling the police if a resident has wandered out of our facility, calling 911 or emergency services if the resident has fallen, calmly addressing a resident who is having hallucinations, and being patient with residents who are showing extreme confusion. A manager should be notified immediately after any situation for further instruction. Even before calling the police or calling 911, you should talk to your manager because they could just be out of the facility with their family. And if a resident has fallen, if you think that it is severe, call 911 immediately. If they seem to be fine but have trouble getting up, call your manager first, and they will call the families to make sure that their wishes are respected. If you have any questions about what was learned today in this video or the company in general, please feel free to reach out. I have attached my email underneath my name and my position, so please feel free. Also, I have attached some free resources in case you would like to research dementia further. I have the alzheimers.org, which is a main condition in which dementia is present, and then support for caregiving with wandering and memory loss and confusion. And lastly, the Mayo Clinic, which is a great resource for just learning about dementia and the different symptoms and causes. Thank you so much for your time today, and I really appreciate you becoming a part of our team.